Harmful effects of smoking marijuana, video created by Dr. O, Institute of Alcohol and Drug Psychoeducation. Smoking marijuana, like smoking tobacco, has several harmful effects on the body, both in the short and long term. Here's a breakdown of the key concerns. Respiratory system. * Lung damage. Marijuana smoke contains many of the same toxins, irritants, and carcinogens found in tobacco smoke. Smoking marijuana can harm lung tissues, leading to scarring and damage to small blood vessels. * Chronic bronchitis. Regular marijuana smoking increases the risk of chronic bronchitis, causing symptoms like chronic cough, increased mucus production, and wheezing. These symptoms may improve if smoking is stopped. * Airway inflammation and obstruction. Marijuana smoke can injure the cell linings of the large airways, leading to inflammation and increased airway resistance. * Potential link to lung cancer. While more research is needed, marijuana smoke contains cancer-causing chemicals, raising concerns about a potential increased risk of lung cancer, especially with long-term use. It's often difficult to determine the exact cause in studies as many marijuana users also smoke tobacco. * Increased risk of lung infections. Marijuana smoke can impair the immune system in the lungs, making it harder to fight off infections. It can kill cells that help remove dust and germs and cause more mucus to form. This is particularly risky for individuals with weakened immune systems. * Secondhand smoke. Exposure to secondhand marijuana smoke is also harmful and contains many of the same poisons as directly inhaled smoke, posing risks, especially to infants, children, and those with chronic lung conditions. Cardiovascular system. * Increased heart rate. Marijuana use can increase heart rate for up to 3 hours after smoking, which can be dangerous for individuals with pre-existing heart conditions and may increase the risk of a heart attack. * Increased risk of stroke and heart disease. Some research suggests a link between long-term marijuana use and an increased risk of stroke, heart disease, and other vascular diseases. * Impaired vascular endothelial function. Even brief exposure to marijuana secondhand smoke can significantly impair the function of blood vessel linings, brain, and mental health. * Short-term cognitive effects. Marijuana impairs attention, memory, learning, problem-solving, and coordination. Can also alter senses, perception of time, and mood. * Anxiety, paranoia, and psychotic symptoms. Marijuana use can cause anxiety, fear, distrust, panic, and, in some cases, hallucinations and delusions, especially with high doses or in susceptible individuals. * Increased risk of mental health disorders. Marijuana use is linked to an increased risk of developing or worsening anxiety, depression, and psychosis, including schizophrenia, particularly in adolescents and young adults and those with a predisposition. * Potential for long-term cognitive impairment. Using marijuana during adolescence, when the brain is still developing, may have long-lasting or even permanent effects on attention, memory, and learning. * Addiction. Regular marijuana use can lead to dependence and addiction in some individuals. Other potential harms? * Gastrointestinal issues. Long-term, heavy use can lead to cannabinoid hyperemesis syndrome, CHS, characterized by severe nausea, vomiting, and abdominal pain. * Weakened immune system. Marijuana smoke can suppress the immune system, potentially increasing susceptibility to infections. * Pregnancy and breastfeeding. Marijuana use during pregnancy can negatively affect fetal brain development, increase the risk of low birth weight, premature birth, and potentially stillbirth. THC can also pass into breast milk, potentially harming the baby. Thank you, source, Gemini AI.